So why is urban planning and health so important? If we just look at the growth in urban population, sorry, clearly I'm not that tall. Just in the last 30 years, there's been a 260% increase in the urban population just within the Southeast Asian and South Pacific region. That's around, 530 million, or nearly 7% of the total world's population moving from a rural area into an urban area just in the last 30 years. Now, on top of that, if we look at Australia as an example, we are the most highly urbanised country in this region. If you discount Nauru and Singapore, we have over 19 million people in cities at this point in time. So most of the people that we're dealing with in this country are from an urban background. And if we look at just in the mid-century, Melbourne, Sydney will have 7 million people. Perth will have in excess of 4 million people. Brisbane will have in excess of 3.4 million people. These are very large cities by anyone's stretch of the imagination. If we also have a look at the migration patterns, coastal towns and cities along the eastern seaboard is where the majority of our growth will occur. And of course, with a greater urbanisation comes greater wealth generally, and certainly a change in diet and certainly a change in exercise patterns. So what health impacts could climate change have on the urban environment? Climate change is just going to be one factor, I think we can safely say. But we're likely to see an increase in disease, either from vectors, and I know that a number of speakers are going to be speaking on this later, or gastrointestinal diseases or other things along those lines. Potentially from extreme events and injuries as a result of extreme events and disease outbreak from extreme events. We're likely to see poorer air quality. This is generally from the overuse of the motor vehicle, an increase in particulate matter, ozone, other volatile organic chemicals and the impacts that will have on human health. Potentially mental health issues. Some of this has to do with not only with the nature of cities and the way that they're constructed and we live in them at the moment, but also through areas of thermal stress, and I'll talk about that a little bit more a little later. And also the potential for prolonged drought and the impact that may well have on our food security and our ability to get fresh fruit, vegetables, and the impact that will have on diet and ultimately on the physical fitness and the like of our communities. So if I can just briefly, I've got about 4 slides, maybe 5, on thermal stress. I'm sure that everyone has heard of the urban heat island or the urban heat island effect. Basically, this is where urban areas heat up more than rural areas. They have, and they stay warmer for longer periods of time. There's none of nature's air conditioning within the urban environment, or there's less of it. And by that I mean trees, green space, those kinds of things. And I guess one of the keys there is the increase in daily nighttime minimum temperatures, or nighttime minimum temperatures, and people not being able to get any relief from that. And I know that there are a couple of people here from Perth, and I just did a quick have a look at the Bureau of Meteorology website the other day, and Perth, I think, had 29 consecutive days over 30 degrees, and quite a few of those over 35 degrees. And just as importantly, perhaps more so, they had 18 consecutive nights above 20 degrees Celsius. So this is, if you've got nowhere to get out of the heat, it can become a real issue. So, but what does that actually mean to, in terms of public health and in terms of people? Well, thermal stress will kill people. People die in the heat. In 2003, as I understand it from some of the literature that I've been reading, over 15,000 people died in France as a result of the heat waves. That's 15,000 people. In Melbourne, during the 2009 bushfires, as tragic as they were, more people died from the associated heat wave than died in the actual fires themselves. And I think that's something that we should all bear in mind. But not only do people die, they also get sick, they go to hospital, and it increases hospital admissions. And that puts pressure on the hospital service, and then can also have knock-on effects from that. So if a hospital bed is I hate to use a public service term, if a hospital bed is clogged up, being used by someone else, then it clearly can't be used for other things. That can be for other sorts of surgery and the like. So it has knock-on effects within the hospital system. There are increased mental health admissions, and I know during the heat I get a little cranky. I'm sure that a lot of people do, a lot of other people do as well. There are then increases in assault also during heat waves. And there is also, I guess, a longer term thing that it leads to a decrease in physical activity. And this ultimately can lead to increasing the burden of chronic disease. I want that. I want that. I don't want that. That's what I want. I want to talk about at-risk groups. Okay, so I've tried to minimise the number of pictures that I could. So 2 at-risk groups there are the elderly and chronically ill. I'm assuming that this older lady here has died of lung cancer, but I could be wrong. But so she's clearly a group at risk. Those people who are obese and physically inactive, and the very young. Those are the major at-risk groups. But there are also those people who are from disadvantaged urban populations or disadvantaged populations, the homeless, who really have nowhere to shelter during thermal stress events. I want to go up. That's what I want. One of the groups, though, that we also haven't, I haven't touched on at this point in time are outdoor workers, and what thermal stress is going to mean to outdoor workers, because really what we're seeing are these groups of people being unable to get out of the heat. They have to work in the heat. It's unpleasant, it's dangerous, and we know that during extreme heat events that the amount of physical activity that people are able to do is going to be less as well. And again, during that heat wave in France in 2003, there was a significant increase in the number of admissions for men aged between 35 and 64 during that period of time. Now, whether or not that's associated with outdoor workers, I don't know. That data needs to be unpacked a little more. But I think that's significant as well. But not only is there the human impact, but then there is the economic impact. So this is from an article from Toronto, the Toronto Star. Toronto being that famous Canadian city, very famous for being very hot. Perhaps not. This group of workers actually had to stop work during the middle of the day for a long period of time, and that had a serious economic impact within the Toronto region. So there was a loss of productivity, and not only did it impact the bottom line for the Toronto government, but it also impacted on the bottom line for many of these workers. These workers were not being paid when they were lying down underneath these. This was underneath the bridge. They're not being paid at that point in time. So they're from a disadvantaged urban population. If they're not able to work, they're not able to be paid, and if they're not able to be paid, then there are serious ongoing implications related to that. Now, I know that today we're here in Queensland. That's why I threw up this slide. I wasn't going to do it, but my wife convinced me that I should. Tourism in Australia contributes over $33 billion per annum. Most of our tourism activities, or a lot of our tourism activities, occur outside. Increased heat waves are going to have a serious impact on that, and it means I'm going to need to buy far more milkshakes for my son than not. But that might be a positive for the milkshake industry, but it may not be. It may be a negative for those who are physically inactive, unlike my son, who's very active. So I guess there are a range of adaptation opportunities, and we'll be talking about those a little more today. But if we have a look at urban environments, they're particularly vulnerable, both from a structural sense, their location, their design, and the materials that are used to construct those cities, as well as from a social perspective. There are concentrations of people from diverse backgrounds. There is poverty. There's inequity within cities. So I guess it's about what are the opportunities that we have there. So it does give us an opportunity to rethink our planning and urban design, looking at increasing green space within the communities, but also allowing for adequate transport and links between places of work and places of living, perhaps combining those together in a radical idea of living actually very close to where you work, and a change in housing design. It's about reducing the burden of chronic disease by providing for active transport, and there are a range of documents available. The Planning Institute of Australia and the Heart Foundation have recently put together a Healthy Spaces and Places document. It's a really good start. And if you see here that it's about providing for active transport. It's allowing people to get out. The photo on the top right and left are both from Hamburg, and looking at their transportation system within Hamburg. And you'll see there's a big red sign there that provides people with an update of when their bus is likely to come. And so just providing a really simple real-time information provides people with an opportunity to know when their bus is coming and get them out of their motor vehicle, walking to a public transport network and moving on from there. This is a house, another opportunity for adaptation, a house which is designed by an architect by the name of Paul Gibson. It's called the Sustainable House. It's built on around about 700 square metres of land. It's completely free from the grid. It's not connected to the water supply. It's cool in summer. It's warm in the winter. It wasn't the cheapest house to build, but its running costs are very low. This house was built at the same time. It's built on what's called community facility land. It's an older person's house. It's designed for older people. It has no eaves. It faces west. It has a black roof. It's going to be very hot. It's going to be very hot in summer, and its thermal properties are limited. But I do note that they have put on some solar panels to run their air conditioning, which is a really nice thing. Anyway, just getting on, I think I've gone 15 seconds over. Our future research, we will continue to be looking at morbidity and mortality with relation to heat. But some of the other areas that we're also going to be looking at is health service planning, urban planning, and recreational planning, and what the impacts of climate change may be on those, and how we can use those tools to better, better meet the community needs for now and into the future. So we want to know what they know about climate change, And what